Alrighty, I see people are already joining us. So welcome, 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 everyone. My name is Alicia Banfield of Banfield's Professional Medical English, here today for one of our regular monthly OET webinars, and today's topic is going to be on aspects of the OET writing paper, specifically common areas that people often just lose marks for when they don't have to. So thank you for joining us. Thank you for interacting with me. As you will know, in the comment boxes, you can add your comments. But first, what I'd like to do is to welcome everyone. Now, today we are streaming on multiple platforms. Again, on the OET Facebook, as OET's Facebook platform, as well as OET's YouTube. But also, you can join us on BPME's YouTube platform and BPME's Facebook platform. With that being said, because I only have one pair of eyes and one pair of hands, I will be posting my questions and focusing mostly on OET's Facebook page. So if you have got a question you really want to answer to, you can post it on Facebook page. But if you are on another platform, another channel, don't worry, because we will also go back and look at those questions. And if it hasn't been answered yet, we'll also post an answer there. However, common questions are common, and chances are someone on OET's Facebook stream is going to ask a question that you want an answer to, so it's not a problem. All right, so welcome, 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 welcome to everyone. When you write in and you say hello, also tell us where you're writing from. We like to see where you're joining from, and it's just fun, okay? So hello, Lakshmi Rajan. Okay, if I pronounce your name incorrectly, please forgive me. I am from Barbados and Germany, so, you know, some names might give me a little bit of a challenge. But there's Patrick from the Philippines. Hello, Patrick. I see that Lakshmi is telling me about her writing. Okay, Lakshmi, we will come back to that. James Sparrow. I love the name Sparrow. Welcome, welcome from Italy. We have Alfonsina, we have Anna, hello Anna, Nina from the Philippines, and Tanya. Okay, so feel free to keep writing in and giving us your greetings. Again, we've got someone else from the Philippines, Rosa, and we have Papa from Myanmar. Hello, from KSA, we have Alma, welcome. And Cindy, you're in Taiwan? You're right around the corner? Okay, I'm in Old Taipei, around the corner from the 101, so I don't know how close you are to me, but just so you know. Actually, I can see the 101 through my window right there. And Andre from Saudi Arabia. So welcome to everyone. So just a couple of points. First of all, you may notice that there is a delay. We are, of course, streaming to multiple channels and bouncing around the world, our signal. So you may notice a little delay. It does not mean there is anything wrong. Okay, so don't panic. Just hold a second and it will keep rolling. So that's one. Two, also you will notice, also I will let you know how we run it. So I know everyone has lots of questions and I will get to as many questions as I can, but what I'm going to do in the first 20 minutes or so is just do a rough presentation of some of the most common issues that come up in OET writing and common places where people lose marks. So it'll be a little PowerPoint presentation. I'll go through it. A lot of the time, people already find their answers there. So I don't have to answer the same question over and over again. Plus, this video will stay on OET's platforms as well as on BPME's channels. So if you miss anything, just go back and watch, and you can always send us a question afterwards. It's not going anywhere. Okay, but then after that 20 minutes is up, you just heard that, I forgot to record here. Once that 20 minutes or so is up, then I'm actually going to go to the streams, and I am going to start answering questions directly from you. Okay, so don't panic, don't worry, we'll get to, if not everyone, most questions. Okay, so Hui Lin, welcome. You're also in Taiwan, I take it. Great, wonderful. Freddie from Ghana, welcome, welcome, welcome. Anusha from Kuwait, and even more. I know there are more of you on our other channels, and I might get to pop over there, but I don't want to be busy with the tech and slow on the teaching. So let's get the teaching going. So give me 1 second and I will screen share, and then you will get to see what, okay. Now, oops, sorry, let's stop that. I always have these little mess ups. I don't know why, but anyway, here we go. I got this, I got this. Okay, and there we are. Okay, so let's try that one more time. We can get this right. Oops, sorry. Now you're on the website. And switch. Okay, good. We're just going to switch over now to the proper presentation format. Yeah, me and tech. Yeah, I run a tech platform, and me and tech always get away. I'm sure everyone can relate to that, right? So let's dig in. Today, we are going to be looking at 2 specific aspects of the OET writing, namely time management and proofreading. Now, these are not the only important parts of OET writing. I know that, but it's one webinar, we can't cover everything. And today, I chose to focus on this because it actually causes people to lose a lot of marks unnecessarily. They don't have that correct time management technique, and so they don't have time to either review or go back and correct, or they either don't know how to proofread, or they're not aware of the items that they can quickly proofread for and pick up marks for. And again, they lose marks unnecessarily. Now, I've been doing this a long time, okay? I'm going into my 8th year, my 6th as a premium OET preparation provider, licensed directly by OET. And I keep seeing the same problems coming up again and again, and saying to my students, you just lost 2 marks for something you didn't need to lose marks for. So we felt so passionate about these very common OET writing issues. And these are just 4 of them that off the top of my head. Picking the correct points in the case notes, organizing points logically, grammar and vocabulary and restating information from the case notes, and time management. I felt so passionately about it that honestly, I wrote 2 courses, one for doctors, one for nurses, that cover everything. It's me there doing video tutorials, but going through systematically all of these areas, and then giving you practice on how to develop those skills. And then you have to do 3 full writing submissions to sending feedback and get grades back. You do it all within the platform. And also in this 3-month course, you also have access to the live group class with a specialist tutor. And I'll be honest with you, Most of the time it's me, but we also have other teachers. And you can find us who we are at promedicalenglish.com. Just scan the QR code. But enough of that. Let's get into today's teaching. Now, everyone will know by now that the OET writing format, you get one set of case notes, 2 pages of case notes, and what we call an exit plan, which is what the case notes are saying the patient now needs. And then you have the writing task, which mentions your target reader, their job role, their address, and the purpose of the letter. And I know purpose of a letter is something that challenges people a lot. I won't go into it here in great detail, but there are other webinars on this. As well as, of course, you can cover this with your tutor or in accredited OET writing courses. You are to write not just a letter, but a formal professional letter, and that has in certain features that you know about when it comes to how you paragraph, where you put your address, the date, how you open and how you close. And you are asked to write approximately 180 to 200 words. Please note, the 180 and 200 to 200 words refer to the body of the letter. That is the space between dear, sir and madam, and kind regards or regards. Just the paragraph information, not the address at the top and not the valediction, the closing, kind regards. And it says approximately, and notice here it is in big letters. Why? Because people waste a lot of time, part of time management, trying to count words and cross out until they get 180 or exactly 100 because they're panicking. Oh my goodness, I wrote 210 words. I am going to lose marks and fail. No. Let me repeat. No. Let me repeat again. Absolutely not. OET does not count words word by word. Rather, this is an approximate amount. So if you write a good letter, emphasis on good, but it's say 210 words, they won't care. You will get your marks. If you write a really good letter and it's 179 words, again, they won't care. You will get your marks. What they're looking at is that definition of good and the reasons why your letter can either be too short or too long. So the case notes are not random. They have tested and tested and tested these case notes because they know that anyone who is at a B2++ C1 level, that is a high intermediate to low advanced or even above level of English, should be able to give the relevant information in this many words. If you don't have that many words to write, it could be that you're either extremely efficient or that you've left out significant information, or if you're writing way over this, like you're all up by 300 words, it could be that your sentences are long and convoluted, you're repeating yourself, or you're putting in a whole bunch of nonsense that has no right in that letter. Okay, you're putting in a whole bunch of stuff from the case notes that actually is not relevant. Okay, so that's how to think about word count. Understand what your 180 to 200 approximately looks like, and go from there. Okay, but don't sit down and waste good writing time counting words. Just don't. Okay. So getting back to my point about time management and proofreading then, remember that you've got 5 minutes reading time, so you can't even not even note taking is allowed. So no underlining or anything. And then you have 40 minutes writing time, but that includes the proofreading. Now I know that today well, let me do this first and then I'll come back to that. So overall, what are the skills? And to be perfectly honest, if your writing is poor, I would advise picking each of these skills one by one, spending some time improving them before you even get on to writing your letter, honestly. In the long run, it saves you time and repeatedly doing the exam. So the first thing is understand the task. It may sound obvious, but often people don't understand clearly what the purpose of the letter is, which is who's the patient? What is wrong with them? Okay, and what are you asking the reader to do? In other words, why are you writing this letter in the first place? What is it going on that is driving you to write this letter? Then you have to understand the relevant points, and relevant points is also in bold as well as specific reader, because remember, you're writing to the reader. So it is not just what you like in the case notes, but what is important for the reader to do their job, not your job, their job. Okay, so what might be relevant to one reader might be completely irrelevant to another. Or what level of language is appropriate for one reader might not be needed for another. So these are things you have to bear in mind. How to organize in logical points is another thing. Okay, so do you need to organize your letter? Oops. Do you need to organize your points in a different way from those in the case notes? And often you do. And yes, you do need good vocabulary. Why? Because often you need to restate things from how they are stated in the case notes, plus the case notes are notes. They're in note form, point form. And in a formal professional letter, you have to write full sentences. Okay. The other thing you need is good grammar. Now, I've heard students, and I've gone sometimes on chat groups and what's not, and actually hear people say, or see people write rather, you don't need good grammar to pass OET. Take one wrong and multiply it by 42. Wrong, 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 wrong. Your grammar doesn't have to be perfect, but you do need good grammar. Okay, cohesion is just how you link sentences together. Okay, are you able to take related ideas, kind of group them together nicely, and so they make sense and they're smooth to read, and also spelling and punctuation. Why? Because those are basic things that you should have learned at even the low intermediate level, if not beginner level. And another point that in the last year I have started to kind of reinforce to students is this: don't forget real life because you are in a language exam. And by that I mean that so many candidates get bogged down in these linguistic criteria, which are important, and the OET criteria, and you know, should I put Ray with 2 dots, and that you forget that OET is based on real life. And you are writing a letter as you would in real life to a real colleague like you. So if you're writing something, honestly, that even you can't deal with reading, honestly, you're doing it wrong. So think about you. You are the reader. What would you like to read? How would you like to read it? What are you accustomed to seeing? Because you're on the job. Well, most of you are on the job while doing this exam, or at least in school while doing this exam. What are you accustomed to seeing? Don't just forget that because you're now doing an OET exam. You are the healthcare professionals. Remember that. Okay, good. So I know that we said it's time management and proofreading, but actually I'm going to start with the proofreading first, if you don't mind. So one of the common errors to look for in your proofreading is misspelling. Now, there's some misspelling, like if you misspell the word hesitate, doesn't matter. Most of the time, the examiner will overlook that unless you've got many spelling mistakes. But just remember, in tests, as in the real life, John Smith is not John Smythe. Just like Losec is not Lasix, and Accutane is not Acupril. Please spell correctly, always. Forgetting to date your letter. It sounds simplistic, but sometimes students get so anxious about starting to write that they forget to put the date in. Don't do that. In real life, it's a legal issue. And in OET, it's a criteria issue that comes under formatting. And remember to date your letters if you are seeing the patient on the last date noted in the case notes. So look for whatever date the last bit the plan is under, and that's the date you use in your letter format. Okay, don't worry, OET knows when you're doing your test. Again, grammar. As I said, it doesn't need to be perfect, but it does need to be good. Why? Because in English, grammar is not just about sentence structure. It tells us things about timeline and what is happening to whom. I don't know if anyone here speaks German, but it's the same thing in German. Your grammar, change your meaning, okay? So tenses, for example, present, past, future, present perfect. For the reader, it tells information like, is it over? Is it continuing? Is it going to happen now? Did it happen a long time in the past? So it can confuse timeline. It can confuse timeline. And the passive voice form is another one, because if you write the passive voice incorrectly or use it incorrectly, it can confuse who is giving and who's receiving. For example, he was counseled versus he has counseled. In one, the person here is doing the counseling. Here, this person is being counseled, so somebody else is counseling them. This is why grammar is important. Spelling, in the test, as in real life, if you have too many spelling errors, the examiner, just like a reader in real life, will go, "Oy, what on earth is going on here? Is this person really a professional?" Disorganized information. Why? Because you should be able to summarize and be concise, be logical, because you do not want to waste your reader's time. Remember, your reader, whether they are an examiner or in real life, a colleague, they're busy. They don't have time to wade through what you think you mean. All right? Get to the point. Get it on the page. Get out. That's it. And informal language, often I've seen, especially native English speakers actually, they tend to use slang and colloquial terms because they're so accustomed to using it in everyday life. They don't think this is a professional letter for an exam. It has to be formal. I should not be using these terms. So be careful with that. And as a language convention in professional and formal letters, you don't use contractions like can't, don't, won't, shouldn't. Instead, you spell it out. Cannot, do not, will not, and so on. So how to avoid and improve on these errors? I call it PPP, like, Premium Preparation Provider. The first P is practice. Don't just write one letter at home on your own and go, oh, I'm ready. Do multiple letters, do multiple kinds of letters, okay? And do them under exam pressure, under that 5 and 40 minutes. So you get accustomed to, you get a gut feeling of what the time is like, and your brain will tell you, okay, you have time, or hurry up now, the clock is going to go soon. The second P is plan your letter. And I'll mention a little bit more about this, because even when the examiner says, you can start, when the, sorry, not examiner, the invigilator says you can start writing now. In my classroom, when I see the students immediately start writing their letter, I go, no, stop it. Why? Because you rush and you start writing, and then your thoughts aren't yet organized. So what's going to happen? You're going to write, erase, write, cross out, write, erase, write, cross out. And then you're going to find yourself after 20 minutes going, I want to start the letter all over again. Horror. It's actually better to take 5 minutes to plan your letter so that when you start writing, it goes more smoothly. So that's the second P. And pay attention. Pay attention to your correction feedback, which you will get. Pay attention to the kinds of errors you often make in your letters. What errors do you always see every time a writing correction comes back? The tutor is saying the same thing over and over and over and over again. That's what you pay attention to. You make a note of it. I always make errors with past tense, comma use, pronoun use, whatever. Okay, and pay attention to those. Those are like red flags telling you that this is where you are going to lose marks on, probably if you don't watch out, okay? And you're gonna see here my feedback with lightning bolts on it. There's a reason I put that there. Because students often, even with me, they'll go, oh, I got, on my last paper, I got, 290, or I got 270, or I got 340 for my letter. And my question is, why? What is the feedback that you were getting on your letters? So if there's a bit of advice I can give you here now about your writing feedback, yes, the grade is important, but you see that feedback, the correction that the tutor puts in, and the teaching feedback they give, this is wrong and here is why, and this is what it should be. That is what you pay attention to, because that is where you learn, and that is where you can put what you have learned in your next letter so that your grade automatically goes up. Okay? So those are the errors and points for correcting them. So now let's look at time, because actually what I just said kind of with this. So how is your time? You've got 5 minutes of reading. In this 5 minutes, please have a strategy for reading. Don't just be sitting down there reading going, what are you reading for? What are you reading for? So you need to develop a technique for summarizing and strategizing this 5 minutes. Now, there are different techniques. I have a couple of techniques that I teach with my students. But one of those techniques, I like to say, are based on the W points. And W points are, again, you saw it a bit before. Who's this patient? Wrong with them? Why are you referring them? In other words, what do you want the reader to do? Okay. How did the patient get to this point? Okay. What is their diagnosis and what is the background? Okay. What are any relevant background questions? Or what is the timeline? How long has this been going on? Or when did this start? Okay. Which treatment did they get in hospital or in care, in your care? Okay. And or which complications? Okay. And why are you now, what are you now asking for? Why are you now referring them on? Now, your W questions, remember, it's your technique, not anyone else's. So your W questions could be different if you are using this technique, but have something nice and compact and concise that you can like rattle it off in your head during that 5 minute reading time. because you can't write anything. Because you can't write anything, okay? Then comes your 40 minutes. And as I said, planning is not a waste of time. And this just goes over what I said before. In that planning, you are going to be identifying your important points. You're going to be making little notes. Planning is not a waste of time. Take 5 minutes and plan, okay? Because you're thinking before you're writing. And once you have picked out your notes and you have decided on the order, you can write your final letter faster and more accurately. Okay. So to help guide you in this planning, you can go, okay, in real life, if I were the reader, how would I want this to flow for information ASAP? Because you're busy, just like they're busy. Do I want to sit down and spend 15 minutes trying to figure out what this person is trying to say? No, I've got like 60 more patients to see for the rest of the day. Give me it quick, give me it concise, give me it clear, and give me it correctly. Okay, so how would I want it? So that when you come to write, what's a logical timeline? What are logical events to put together? And what are the most important points to put first? So these are things that are in your mind as you are doing your planning, and then you start to write your letter. Okay, so here are just some quick examples of papers that I have corrected and errors people have made. And when I send it, OET, why did you not make this correction in your proofreading? Because look, I have now to take off a whole 2 marks for these kinds of errors because of how frequently you have made them, okay? So this person says, Mr. McCleary first presented on the 21st of January with a 2-month history of disingestion, which was, I'm sorry if my picture covers the screen, but hopefully it doesn't. It may, which was characterized with, frequent belching, burning, and tightness sensation under sternum in an off and on manner. At that time, his cytomes lasted 5 minutes to several hours, aggraved by stress and heavy meals, relieved by antacids and rest. He denied vomiting, chest pain, dyspnea, and dizziness. On examination, there were no abnormalities rather than mild blood pressure. A previsional diagnosis of GI reflux was made, and omeprazole 20 milligrams once daily for 2 weeks was prescribed, and he was scheduled for follow-up appointment on whenever. Now, this clearly has in multiple errors of spelling, errors of word choice, and errors of punctuation, as well as grammar. And this person's writing is not going to improve. This person's language is not going to improve from the first paragraph to the next. That's not how languages are learned. But in proofreading, there's some common things that they could have picked up, which was characterized by, okay, in an off and on manner, in an off and on manner. I don't know why that was highlighted because it's correct above. Anyway, his symptoms, so not cytomes, but symptoms. So you would have picked up the spelling error as well. Lasted 5 minutes. Take out the A. It was aggravated instead of aggraved by stress and heavy meals and relieved by antacids and rest. He denied vomiting, blah, blah, blah. Chest pain and dyspnea, spelling. Okay. Going on here, A, not previsional, but provisional. That's a minor typo. Diagnosis of blah, blah, blah was given, and prescribed with B, not prescribed. Now, these are spelling things that in proofreading, this person could have picked up. And because there are so many errors, like spelling, they would lose marks because there's so many. But if they had corrected that aspect, then there's less of a chance that they would have lost that spelling half mark or full mark, okay? So this letter could have actually have been, with correction of these errors, a bit of a C+, okay? As opposed to a C, all right? And then this is an example of organizing the information more correctly. And this person, even though there are mild errors in here, and I won't take any more time with this, you can review the video and see it. This person was able actually to pull off a high B, because look, this person has made errors. A small error here, 2, should have written it out, and Ramipil was discontinued. This was omitted information, but there's so few errors here, and it was such a nice read. It's like, okay, not as many marks lost, okay? So once again, all of these points and more on improving your OET writing, recognizing and overcoming common OET writing issues are there with me saying a lot of what I said today. They're there in the course because it's a combination of things that helps you get a higher score. Practice and planning and proofreading all come together to get you a higher OET writing score. And by writing more efficiently, you have more time at the end to proofread and pick up and correct common errors. And I'll give you just a little anecdote, a little story. I've had a patient, a student who's had ADD, although she was doing the OET exam. And yes, her attention did used to wander during writing. But by helping her with her planning technique, she came back to me afterwards and she said, oh my goodness, I did have an episode in the exam. And when I got back, I only had 20 minutes left. When my mind locked back in, I only had 20 minutes left. And I just wrote my letter with the tips in my head, and she actually wrote the final letter in 15 minutes because she had planned it out. She had planned it out. And she actually got 370 for her writing because she wrote it in 15 minutes. She had 4 minutes to proofread. She picked up her exam, she picked out her mistakes and corrected them. And she actually came out thinking, oh my goodness, I lost so much time with attention in the exam that I won't pass, but she got 370, okay? So there it is. So on that note now, I hope as I went along, maybe I covered some of your points. So I'm gonna go back now, and remember I am in OET's Facebook, and I'm gonna answer some questions. I'm also here going to put PS, ProMedicalEnglish.com for those of you who want perhaps to go to the website. I've just shared the website there, and also, okay, oops, sorry, I've just had a little issue there. So let's see questions that people have. I'm going to scroll back up to the top. Someone I noticed higher up had said, let's see. Anusha has asked, is it okay to write a known patient of yours requires a care and management in the introduction? Anusha, the correct thing that you might want to say is perhaps I saw your patient today, and oops, let me go back to the comments. I saw your patient today and they have so and so and so and so, and they now require your ongoing care and further management. Okay, you could say a known patient of yours. Grammatically, actually, it's correct, okay? But a little bit more refined might be, dear so-and-so, today we have seen your patient so-and-so who has been diagnosed with or who has so-and-so and so-and-so and now needs ongoing care and your further management. Okay, so I hope that helps. Hello, Abdul in Pakistan. I hope you're doing well, as well as Samuel and Zell, both in the Philippines. Good. And Chido in UAE. Welcome. All right, let's move on to the next question. Mukhtar has asked, has said, thanks for your time. Could you please tell me what to write if they give us the name of the mother and the date of birth of the baby? Those notes from OET Molly Smith. Actually, yeah, I did Molly Smith just the other day. All right. So what you write, if you're writing, you write to the, of course, the address of the person and then the date, or you could put the date or, and the address. Dear, I can't remember. I think it was Molly's. I can't remember who the person you were writing to was, but dear whoever, Ray, and you put the baby's name and the baby's date of birth. Okay? And you start and you're talking about the baby, and then you can say so-and-so's mother and give the patient's name. So this baby, John Smith, was seen and was seen today and diagnosed with X, Y, Z. His mother, first his mother, comma, and give the mother's name, Anne, what brought him first 2 days ago because she was concerned about blah, 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 blah. Okay? So that's what you do. The patient's name should be the one that is highlighted, but mention the mother as early as possible and mention the mother by name, or the parent by name, or the caregiver by name. Okay? So case notes from OET Molly Smith, date of birth 2003. Oh, so Molly Smith. So Ray Molly Smith, date of birth 12th of June. Baby, Molly's mother, Mrs. Ann Smith, brought Molly because she was concerned that. Okay. All right, 1 second. My screen is a little frozen, so I'm just going to mention the mother as early as possible. Good. Right, so coming down now, let's go back. Do you suggest making an outline in those 5 minutes? Not a detailed outline, Amos. Not a detailed outline. You want to put either bullet points, or if you're doing the paper-based test, actually just underline the important points on the case notes and make little notes about, okay, I want to put this first, that second, that third. But a detailed outline, no. Why? Because inevitably a detailed outline is going to just stretch out and stretch out and stretch out and take longer and longer time. You don't want to do that, okay? But what I like to tell students is just underline, decide what you want first, and just kind of run it through in your mind very, very quickly. Okay, that flows nicely. Yeah, but a detailed outline, no. Okay. So that is that one. Can you give us an example of an outline for letter planning? Well, actually, AC, there are different ones you can use. Actually, like there are 2 or 3 that I use depending on the student's style. But I think actually, if you look back, there's a tutorial video also on OET about an outline. But an outline is a technique. A technique could be, you go through the case notes, you just underline, literally just take a pen and underline. Now, of course, I'm talking about people doing first paper-based tests. I'll talk about computer-based tests. In the paper-based tests, just underline, because you can write on the case notes, and then maybe run through, okay, this is the most important, so I'll put number 1 here, or the letter A here. And okay, I want to mention this next, and I'll put number 2 or the letter B there. And just do that. And then just go, okay. So I start by saying this, there's so-and-so, I want okay, that flows. The good thing about that is if it doesn't flow in your head, chances are it's not going to look right on the paper. So then you can just tweak things and do it again. All right. But the emphasis is, I would say, don't spend more than 5 to 7 minutes doing a planning what you're going to write. It takes practice, but you can learn to do it. And then once you do that and it flows in your head, then start writing. Okay. So that means I've answered AC's question. Okay, good. About how many minutes. The reason why I say 7 minutes is because once it's planned, you can write faster and then leave like about 3-4 minutes at the end to proofread. The reason why I say 3-4 minutes, do not give yourself 10 minutes to proofread, because I know some of you, you're going to try to write the letter over again from scratch. Don't do that. You will run out of time. Okay, good. You can make notes before starting the letter, Frida. As I said, yes, you can. But you cannot make notes in the reading time. So in that 5-minute reading time, you know how healthcare professionals are. If you've got a pen or a pencil in your hand, there's a temptation to write. It's just what we do. Okay? Have nothing in your hand but the paper. Okay? And your technique for whatever, for summarizing what you read. But once they say you can start writing, that's when you can start underlining and making any notes. So I've answered lots of questions on technique. So I hope I answered some of those. Coming down, the provisional diagnosis can be placed in the purpose, definitely. Has a provisional diagnosis of, has a working diagnosis of, has a diagnosis suggestive of, yes. All right. And Anika was giving, some of those corrections. Disingestion, exactly. It's indigestion. So that's a vocabulary and spelling error. Thank you. I thought after 5 minutes reading, we don't have access to it. No. So let's talk about the computer-based test for writing. In the paper-based test, you have the case notes there always, and you can physically scribble on them. Let's talk about the computer-based test. On the computer-based test, the case notes are always there, so you can see them all the time as you write. However, you cannot underline or highlight in the case notes. However, if you want, and no, you cannot have note paper or whatever around. However, what you can do is in the window for the writing, what you can do is look at the case notes and go, okay, I want to put this first. Look at the case notes, I want to put that second, and actually list the points in note form, of where you want to put 1, 2, 3, 4, 5, and then flesh it out. So provisional diagnosis this, so then you just thank you for seeing this person who has a provisional diagnosis of, and then you just write around it, honestly, because you can edit in that time, in that window, Okay, so put the points and then flesh out your sentences around them. Okay, let's keep going then. I think I have to, oops, hold on. Let me renew again so I can see. As I said, my feed is a little slow. Oops, hold on. Let me renew again. Good, so let's see. Yes, you will have all details available during the exam. Good, so you know. The case notes giving, so this is the name of the mother. Oh, this was, Makbar was asking the difference between the mother and the child. If it's the date of birth will tell you, the notes will tell you who's the patient. Okay, remember this letter is about the patient. The mother or parent is important too, but remember this letter is about the patient. Okay, so the ray line is about the patient's name, the patient's date of birth or age. And then you start talking about the patient, but quickly mention the mother. Her mother, or this patient's mother brought them because they were concerned about, and you give the mother's name. Okay. What is the meaning? Oh, Frida has a vocabulary question asking, what is the meaning of ubiquitous? Ah, good question. Ubiquitous means found or seen everywhere. Okay. So for example, today, use of the internet for research is ubiquitous. Or problems with identifying the correct points to put into the OET, an OET letter is a ubiquitous problem that students have, irrespective of their profession or their language level. Okay. So I hope you understand the word ubiquitous. Right. Inoka is asking how to write drug frequency in a letter using and also numbers. Okay. Now, let's look at the numbers first and then the drug dosing, if you don't mind. Now, there is a convention in formal letters when it comes to writing numbers. Once it is like 10 and under, you spell out the word. So you spell out 1, O-N-E, 2, T-W-O, 6, S-I-X, 9, N-I-N-E, 10, T-E-N, and so on. But once it is 11 and up, then you write the number. Now that is an old convention. Do not ask me where it comes from. However, in real life, you know, as a healthcare professional, that, let's be honest here, when you read a professional letter, numbers kind of jump out at you immediately. There's something about 1 that jumps out quicker than the word E-L-E-V-E-N, 11. So what I will say is this: write it as you see it in the case notes. And oddly enough, this also goes for dosages. So if the case notes have it written once a day, as in O-N-C-E-A-D-A-Y, or once per day, P-E-R-D-A-Y, write it just like that if you are unsure. However, and this goes especially for OET for doctors and OET for pharmacists, because you guys are even more accustomed to the Latin and Greek abbreviations. And if you are writing to a fellow colleague, like doctor to doctor, pharmacist to pharmacist, or somewhere in between there, you know that if you write OD, that is internationally accepted as once a day. Or if you write BD, that is internationally accepted as, like officially, formally as meaning twice a day, QDS or QID, and so on. Because you're using this international standard abbreviation and you're writing to a colleague that you can reasonably expect to understand. With that being said, these days, of course, you could be in the US writing to somebody in Saudi Arabia, and they may not know, and you might want to play it safe. So if at all you are not sure, spell it out or write it exactly as it is in the case notes. Okay, good. Can you use a pencil instead of pen for writing, reading, and listening? Yes. As a matter of fact, for writing, it's especially good because, of course, you can erase. However, you don't want to be spending a lot of time erasing. Okay? A neat line through takes a lot less time. Straight line through and write above it, or draw an arrow down at the bottom and put it there. OET will not read anything you have put a neat line through. And if you put an arrow that clearly shows this sentence is for here, they will read it. They will take it into account and know you will not lose marks. Okay, good. Let's go on. Does spelling mistakes acceptable in the list? Oh, so okay. Let me first see if there are any more questions about the writing, and then yeah, you can ask any questions about anything else. Do we have OET for midwives? Midwives come under nursing. So for midwives, you would do the spelling, I have spelling on my mind. You will do the speaking and the writing for nursing. Midwives do the speaking and the writing for nursing. Is writing different for physiotherapy? Yes. Physiotherapy is one of the recognized OET 12 professions. There are 12. Physiotherapy is one. You do the same reading and listening as everybody else. Everyone does the same listening and reading. But for physiotherapy, your writing and speaking will be specifically for physiotherapy. It will say so on your papers, and they will actually check and ask you to check during the test to make sure that you have got the right paper for your profession. Okay, is the introduction part of the word count? Valia is asking. Yes, it is. So again, as I said, once you start writing dear Dr. Brown, or dear nurse in charge, or dear sir and madam, comma, they start counting from there down. And they stop, the last set of words they count is, should you require any more information, do not hesitate to contact me, whatever. However you close that last sentence. Kind regards nurse, kind regards doctor, kind regards pharmacist, kind regards physiotherapist. They're not going to count that. They don't care. Okay, so the body of the letter is the 180 to 200 words. Thank you. How to write dates. There are many conventions for writing a date, and these are formal, internationally recognized conventions. You can go online anywhere and find them. But what I advise students, my students, to do is find one convention that you use and stick with it. So you use that convention for the date, you use that convention for the patient's date of birth, you use that convention for any date information you give in the letter. Okay. Commonly, there are about 4 or 5. So for example, I can write in the comment section. So for example, date conventions. Example, 1st December 2023. Yeah, that's one convention. 1/12/2023. That's another convention. December 1st, yeah, 2023. That's another convention, okay? Or sometimes instead of dots, they use slashes, okay? Like 1/12/2023. These are formal and internationally recognized standards. So just Google it. International standards for date format, or yeah, date formats. Pick one. And that's it. Okay, good. Is it different for doctors? Essie, what do you mean for doctor? Is it? What is it? You mean word count, layout, what? Case notes are definitely different for doctors. Yeah. Okay. So Mame said, this is how I have been writing my conclusions. Is it okay? Given the above, it would be appreciated, Mami. It would be appreciated if you could kindly provide. Given the above, it would be appreciated if you could kindly provide. Right? That's how you write that, Mami. So hopefully that helps. Okay. Good. Someone had, Shaikh had also asked, let me go back about spelling mistakes in the listening. Spelling mistakes are acceptable in the listening with a proviso. So the goal of the listening, and of course you mean the listening A, the goal of the listening A is to see if you identify from listening the correct detail at the correct time in the correct context. And the audio is running and running and running. So there's a little room there if you drop an E here or whatever, but the examiner can clearly see that, oh, okay. They heard it at the right time, they heard it at the right context, in the right context. It's fine. However, if you misspell the word so horribly that either one, the examiner can't even tell what the word is, or two, you actually spell another English word, what you have done is, when you spell another English word, is you have changed the context. So you get it wrong, okay? So an example I love to give is waste and waste. So there's waste. Anybody here who speaks German, Gürtel, or cintura in Spanish, or waistline. Sorry, my Chinese isn't good enough. My Mandarin isn't good enough yet to say it in Mandarin. But that is W-A-I-S-T. Okay, so say the patient was getting a rash around their waist, W-A-I-S-T. But you put W-A-S-T-E, which is garbage, müll, basura. Yeah, you have changed the context. That ain't right. Okay. However, if the answer is vegetable and you put, instead of V-E-G-E-T-A-B-L-E, you put V-E-G-E-T-A-B-E-L, they realize that you've got it right. You get it. Okay. Or if it's vegetables and you just drop the S and put vegetable, they will put that down to exam pressure and it'll be fine. Okay. Or you put an extra A when it was supposed to be an E or something. Chances are, because the listening A is corrected by a real person, it is reviewed by a real person. So there'll be that allowance. However, and everyone listening to this webinar, please note, in the reading part A, however, spell it correctly. Why? Because accuracy in spelling counts in the reading part A. And they will take note and they will take off marks if your spelling is inaccurate. Why? Because as in real life, you have the material there, the very least you can do is copy it correctly. Because again, in real life, remember, John Smith is not John Smythe. And LASIK is not LOSEC. Spell it correctly. And I'm talking about the reading part A, okay? Going back to the listening part A, it could very well be that you hear the word, but you are not sure how to spell it, either because it's a word you never heard before, or the accent or pronunciation of the speaker it threw you off. In that case, write as close to what you hear as possible. Write it as it sounds, because there's a chance that it is so close to the correct spelling that you get it right. It is a chance that the examiner looks at it and go, well, actually, when I sound it out, that is actually how it sounds. So, all right, because it might be one of those odd English words that sounds one way, but is written another. All right, good. Could you get more light? Now, Bisubi, I would love to, but my time is up and I don't want OET to cut me off. However, Bisubi, what you can do is you can send us an email asking for more questions, asking for some insight, or you can sign up for most of our courses. You end up in class with either me or the other live group class teacher anyway, and we will definitely cover that selecting correct points. Apart from which, I am sure, absolutely sure, that OET has a webinar on choosing the right points in case notes. Yeah, all right. All right, I'm going to answer 2 more questions and then we're going to call it a day for today. So let's see. We did that. Shaik is asking if they have mentioned dates in a letter, for example, like she had nausea and vomiting on so and so she had it. Do we need to mention the dates? Actually, Shaik, that's a good question. And this comes down to the ability to summarize. Okay. The ability to summarize in your writing becomes especially important when you have got like one symptom tracked over multiple days. Do you really want to say, well, on this day it was high, on that day it was 2 points lower, and on that day it was 1 day higher? And you need the ability to summarize trends. And this is actually a grammar and vocabulary aspect, element. Okay. So if you notice in the case notes, on this day, you said what? Nausea. Okay. She first had nausea on this date, and over the next 3 days, 4 days, a week, her nausea increased too, or her nausea improved, or her nausea settled. Okay. But saying on day 1, she had nausea 3 times. On day 2, she vomited 4 times. On day 3, she vomited 6 times. On day 4, she only vomited once. Summarize. Okay. All right. So one more question. In many videos, so this is Chaitanya. In many videos, it has been mentioned that listening is checked by computer online. So how will a computer give marks for little mistakes of listening part A? Listening part B and C are checked online, okay? Because it's either right or wrong. There's no spelling there. It's either right or wrong. But can a computer, have we gotten so high advance in AI that a computer can actually read people's handwriting? Well, actually, yes, we have. Yes, we have, thanks to Google Translate. But as far as I'm aware, up until my last knowledge, and I update and check and make sure, listening part A still gets an eyeball from a human being. Because the other thing is, you might cross out and write it above, or you might put an arrow and put it at the bottom or at the side. And once you put that arrow, they are going to read your answer. Can a computer completely do that? Listening A, as far as I know, I will check it again after this, but as far as I know, up until I last updated, it does get, the listening A gets an eyeball. Listening B and C, however, computer. Felanka is going, what about vegetable, vegetable? They might give it to you, or they might say, at this stage in your writing, honestly, you should be able to at least spell vegetable a little better than that. But it sounds like vegetable. It clearly shows that you have heard the word vegetable. However, I will say this, write it down, you never know. Remember, we're not examiners. We're not in the room with the examiners. We don't even know what the examiners are. As a matter of fact, the people writing the OET test paper don't even know who the examiners are, okay? And examiners differ. And your papers are usually, your writing elements are usually, and listening elements are checked by 2 examiners usually. I'm not sure if that goes for listening, I will admit, but give the examiner your best, okay? And after that, you can only hope for the best, all right? There's so many different permutations and combinations, just give it your best. Right, okay. On that note then, we went 15 minutes past, so we're out of time. However, I hope I was able to shed some light, give some guidance, and give a few tips. If you have any questions, you can check out our website. It is here in the stream, as well as you can go back and look at our OET courses. And if you have any questions at all, we're also on WhatsApp. You'll see the WhatsApp link directly on our website. We like to keep it simple. So just click the link, send a WhatsApp, and you get an answer. And actually, it's me you get the answer from. I'm the person on the line 90% or more of the time. Okay. So thank you, everyone. And for those doing OET this weekend, positive vibes, all the very best to you. And for those of you with OET coming up, study smart, don't take shortcuts, do it right, and all the best for success. Bye-bye.